as nurses, we provide a critical role in heart health through education, prevention, and providing compassionate care. We take the time to sit with the patients and try to get to understand what they already know so that we can tailor our needs around educating them specifically how it benefits them. Cardiovascular disease is the leading cause of death in the U.S., so it's really important that we stress the risks that occur with heart disease. So meeting the patient where they're at, making sure that they understand, what it is that they need to be working on their own to be able to live a healthy life. At CHSE, we're training the next generation of nurses to be heart health advocates, combining evidence-based care with a deeper understanding of diverse patient needs.